If you have been diagnosed with cancer, you know that it can turn your life upside down. Welcome to the Inspired Vitality Show. I'm Catherine, and I was diagnosed with stage 3 breast cancer at the age of 46. Whether you are a patient yourself or have a loved one with cancer, you will gain some insight and information in this video. I'm going to talk about what a mastectomy is, a little bit about the emotional impact, as well as some practical tips. In previous videos, I shared parts of my story in lessons learned leading up to a cancer diagnosis, and then what it was like for me to meet my doctors for the first time in oncology and surgeon. Be sure to check those out if you haven't already. Both my surgeon and oncologist agreed that for my type of breast cancer, it would be advised to begin my cancer treatment with a mastectomy. When I met my oncologist, one of the things that we talked about was a single versus double mastectomy and the pros and cons of each. I was given a choice, and I chose to have a double mastectomy instead of a single, primarily because I was afraid if I only had the cancerous side removed, I'd be more at risk for developing cancer in the non-affected breast. Now, there may or may not have been scientific data to support this, but emotionally, it's what I needed to do for me. In addition, I had a friend that pointed out to me that if I decided to have reconstruction, it's easier to achieve symmetry with 2 implants rather than 1 implant and a natural breast. What is a mastectomy? It is removal of the whole breast. There are different types of mastectomies that can be done. For example, there is a simple or total mastectomy, which is no lymph nodes involved. There is a modified radical, which is breast and some lymph nodes. Then there is a radical mastectomy, which is the breast, the lymph nodes, and the chest wall muscles under the breast. Then there is what is called a partial mastectomy and a nipple-sparing mastectomy. My particular mastectomy was scheduled for March 26, 2015, which was exactly 3 weeks after my diagnosis. Logistically, I was expecting to spend 1 night in the hospital and that the pain would be controlled. I had been told that the pain from the removal of the lymph nodes would be the worst part. Emotionally, I had been in function mode from the point of diagnosis, but it became very real when I got to the hospital. I recall a moment after getting changed when the nurse was going through information with me and she asked me how I was doing. She was being very sensitive to the situation. I said I was okay, and then I realized what time it was, and I decided to make a call to my children, knowing that they were up and getting ready for school. After saying goodbye to them, the tears started falling silently from my eyes, and it was at that point that the nurse gave me a sedative. Although a mastectomy is a physical surgery and done for life-saving measures, it can have a huge emotional impact on the patient. Cancer patients, I'm talking to you directly now. I encourage you that if you have or are going to have a mastectomy or really any surgery for any cancer that alters your body, be sure to acknowledge your feelings. If you're in a relationship, talk to your partner about how you're feeling. Remember that there is no right or wrong way to go through cancer treatment. The beginning stages of a diagnosis are extremely busy and overwhelming, so I like to suggest that patients try to have what I call cancer-free hour. Regardless of if you live alone or with others, I suggest you take time each day to do anything that takes your mind off of the cancer. Maybe it's watching a movie or chatting with someone about everyday matters, but it's important to take a break from thinking about the tests, the surgery, the treatment, whatever you have going on. There is nobody that will understand what you are going through better than another cancer patient who has experienced the same type of cancer. There are many social media groups out there that you can join for support and information. For me, I found breastcancer.org to be helpful for me. At times, I used it for gathering information, but a word of caution. If you're feeling scared or vulnerable, sometimes reading all the information out there can enhance those feelings. I found the support of the community on that website. They have message boards, and it can be a really bonding experience. I wish I had actually joined it sooner than I did. If you seek out online information or support, take it all with a grain of salt and know that each person's cancer experience is different. For a mastectomy patient or any patient that has surgery that might have surgical drainage tubes to deal with post-surgery, here's a practical tip for you. There are pouches or belts that are made to help in the shower. So when you have surgical drainage tubes, the drains come out oftentimes on the side, and they have these bulbs attached that fluid goes into. And there are, like I said, these belts with pouches that are intended to go into the shower, because that way you can still shower, but you have a place to put the tubes and the bulbs. When you are getting dressed with these surgical drain tubes, a couple of options are to pin the bulbs or the tubing to close. And I know before I left the hospital, I had a nurse who put a piece of tape around the tubing, and then she stuck a safety pin through that piece of tape, and then we could use the safety pin to pin it to my clothes. Or another idea that a nurse gave me is to use a hoodie, a zippered hoodie, but turn it inside out, so that the pockets are actually on the inside, and you can tuck those drainage bulbs on the inside of the hoodie and then zip it up, and no one's the wiser. Caregivers, friends, loved ones, a really great gift for anybody who is going through surgery, whether it's cancer or something else, is the gift of soft pajamas. It was one of the best gifts that I received. And because of the mastectomy, there is an effect on the nerves. So when a person has a mastectomy, they have nerves that are damaged from the surgery, and it can be painful when those nerves regenerate. And to have soft pajamas, particularly ones that have button downs, was one of the best gifts that I received, and I highly suggest that for any cancer patient. The gift of soft pajamas is such a wonderful thing. I want to give you a quote by another breast cancer survivor, and her name is Brenda Jones, and she said, "Be patient and don't give up. Trust me when I say you will come out changed and stronger on the other end of this." I hope this helps you understand that there is no one-size-fits-all treatment for any cancer, and there is no one right way to go through it all emotionally. The process can be improved for the patient with emotional support and practical items throughout treatment. If you have found this to be helpful, please subscribe to my channel and click on the bell to be notified of any upcoming videos. See you soon.